All right. Well, good afternoon. If you're on the East Coast, everyone, this is Brandon Gear with the National Minority Quality Forum. Looking forward to a very thoughtful and necessary panel today as we head into flu season. Before I start, I want to give a shout out to Winston-Salem State because they produced our very own Keiko Purnell, and without her, I don't know if we'd be able to do any of this stuff. So shout out to that university for all they do, but especially for Keiko, we really appreciate it. Without any further ado, I'd like to turn it over to our great moderator, Mia Keys.
Thank you, Brandon. Thank you, Keiko. And of course, as always, thank you to the National Minority Quality Forum for just giving us this stellar platform to discuss these issues that are really salient to our day-to-day lives, but we might not take time out to discuss them in depth. And so I'm grateful for our presenters, our experts who are joining us today, and they bring myriad perspectives to this conversation around influenza, the vaccine, and also what that means in the season of COVID-19. And so speaking of our experts, in terms of who's joining us today, we have Dr. Laura Lee Hall, who joins us as the COO of Sustainable Healthy Communities and working with the National Minority Quality Forum and everything that she's done. Prior to her current role, she had founded and led the Center for Quality and Office of Grants at the American College of Physicians, which is an organization that many of us are familiar with. And myself being from the AMA, we do a lot of work with them. And then prior to joining ACP, and that was in 2011, if I'm not mistaken, Dr. Hall was leading the strategic educational initiatives at the American College of Cardiology. And at that time, she was able to link a lot of educational and performance improvement programming with ACC and their clinical registries. And so she brings with her just a wealth of information, not just from that, but then also she's able to inform us in a lot of ways about mental health. And at some point, I really hope that we can tap into her knowledge around that and her capacity, her previous capacities in that way. So we welcome Dr. Laura Lee Hall. We also have joining us again, Dr. Shanina Knighton. She was with us a couple weeks back, and we were talking about COVID-19 and how to best communicate best practices and healthy practices through infographics. And we're going to revisit a lot of those conversations today. By training, Dr. Knighton is a clinical nurse scientist and an infection preventionist at Case Western Reserve University, where she's also a part-time assistant professor in biomedical engineering. She focuses at Case Western on design, development, implementation, evaluation of technologically based interventions, include whether those are wearable sensors, machine learning, simple technology, and helping patients to really, especially older adult patients, manage their care across various settings. And so especially what's really interesting about Dr. Knighton is that during COVID-19, she's been super instrumental in just providing practical prevention tools, communication and guidance, messaging, and guidelines to members of her community, of the larger community surrounding her institution, but then also throughout the US. We're really grateful that she's bringing all of that today with us, and thank you for joining us again. And then also we have with us today Reverend Dr. Terrace King. He's esteemed pastor of Liberty Grace Church of God, and where there he's the pastor and preacher, second generation ordained Baptist pastor and preacher. And today he's going to bring us a word, not just in terms of where he stands with generating faith and using faith to really uplift and ground his practitioners and his community in his faith and the faith of themselves. But then he's also quite committed to transforming healthcare communities and companies through his own expertise and advice in creating innovative models that lower cost of healthcare, that improve the quality of health, and thus overall quality of life for Americans. And then also he's been recognized by the mayor of Baltimore for his work that he's done throughout the city, especially with youth and young people, with children. And we're really excited today to learn more about what he's doing, especially as he's done work through his own enterprise called the King Enterprise Group, which is an initiative that focuses predominantly on the consulting of fast-growing, fast-paced small businesses through contracts with the Department of Health and Human Services and their IT department. So I'm quite grateful today for Reverend Dr. King joining us, for Dr. Knighton being here, and then also Dr. Hall. And so before we jump into each of their presentations, Dr. Laura Lee is going to lead us through a presentation. First, I want to engage the audience a bit and ask you some pertinent questions. We're talking about influenza, we're talking about the flu, especially because now we're transitioning into flu season, right? But COVID is still with us, right? And so I want to know, you can answer this via the poll that we'll pull up here on the screen. Have you received your flu shot this year? Yes, no, not yet, but you're planning to, or not yet? So just go ahead and let us know what you've got there. And then also, and we'll pull these up later, because I think that will be, thank you so much. I think that will be really instrumental in our leaders, our experts today in their talk. We also want to know if, now that you've thought about yourself, what are overall barriers that you imagine to receiving the flu vaccine or dissemination of the flu vaccine in communities of color this year? And we'll pull this poll question up as well. So is it fear of COVID-19 exposure? Is there ongoing mistrust of vaccines? Is there a lack of belief that the flu can be a serious illness, or is there a lack of belief that the flu vaccine works? Is it cost related? I'm not sure if that'll come back up on the screen right now, but once it does, go ahead and Keiko, we'll go ahead and close the first poll, and then we'll open up the second poll and see what's going on there. Okay, so most of you are saying you've not yet received the vaccine, but you're planning to. Okay, for our presenters, let's keep that in mind today too. We also have a little over 10% who are saying they haven't received it. But what about the second question? What are the barriers in your community, especially amongst Black, Indigenous, other people of color? Okay, the biggest barrier, let's see. I will also make a choice. All right, well, let's just give that a couple of seconds, and then we'll close the queue in about 10, the poll in about 10 seconds and get those results. But in the meantime, I do want to remind you all, if you have questions for our presenters, you don't have to wait until the end, but I ask that you put your questions in the question and answer box, which is just below. And then if you want to respond to anything that they're saying, but not necessarily in a question form, just put it in the chat box, okay? So responses, reactions, put it in the chat, questions, Q&A box. Sounds good? Okay. All right, so we're gonna open it up. I would love to see these, the answers to that last question first before we pass it on over. All right, I figured that was gonna be the case. Mistrust of vaccines is the biggest barrier to flu vaccination in communities of color, according to our audience members. So Dr. Hall, I'm going to throw it on over to you to open us up, and let's see how we can bring it all together. Thank you so much.
Thank you. Let me get into slideshow mode here. Can everyone see my screen?
We can see your screen.
And you can hear me because you answered my question. Let me move this out of the way.
Yes, ma'am.
Welcome, everyone. I'm so delighted that you have spent time with us today. I know so many people are working so hard, too hard in these days, confronting the health crisis that's before us, as well as some of the important social issues. We are really delighted to be able to release this afternoon the results of an activity we've been working on regarding promotion of influenza immunization. And you see the title right here. I am the president of the Center for Sustainable Healthcare Quality and Equity, part of the National Minority Quality Forum. Let me advance. I'm going to tell you a little bit about what we've done, what we're releasing, and what is going to go on afterwards, which is even the most important thing, before turning it over to my wonderful colleagues. I think most of you, if you're on this webinar, know that we are part of the National Minority Quality Forum, founded by and led by Dr. Gary Puckrin. And it's been a real honor to work with him these last 3 years in helping to promote evidence-based health equity. He invited me to help launch the center, SHC, really to bring this data that he's been such a maven at using into action with tools of education, research, training of clinical teams, and community leaders. I want to acknowledge that Santa Fe Pasteur has supported our efforts on this project and thank them for that. I also want to acknowledge our program manager, Naomi Oladibe, who has really helped us move the program forward. And I want to especially honor Dr. Poland and the action planning group. Notice that we didn't call it an advisory group because we were really geared towards making something happen. So in really tiny print here, I'm showing you the members of this group. It reflects multiple disciplines, as well as researchers, clinicians, community leaders, and patients. I'm not going to go through it, but these folks really provided excellent input and guidance to where we're going. I'm glad to share these slides with anyone who wants them as well. So background. We convened a range of stakeholders and experts to reassess influenza immunization rates by race and ethnicity in light of research and practice improvement activities that we've been involved in over the last couple of years and the current circumstances raised by COVID-19 pandemic. So 2.5 years ago, we had our first panel meeting, again, led by Dr. Greg Poland. And the result of that advisory group, as we called it at the time, was simply that it was unacceptable that flu vaccination rates remained so far below what we think would be optimal to protect the health of the population, and that we needed to implement in an evidence-based fashion activities to increase the flu vaccine rates in communities of color. And we did a number of programs in partnership with 3 healthcare systems in different regions of the country. We began actually that first year in December. Everybody's usually putting their flu vaccines to bed by then, but we actually worked with an FQHC, a large academic center, and a multi-site health system. And they started small and they started late, but they achieved significant improvement. And I think I have a build here. What we did with them was, in essence, to help them look at their data and to train their whole clinical team to make a strong recommendation and to put that into the workflow in a way that made sense. They achieved real improvement, and I think as importantly, they were so engaged in the activity, they all signed up to go for the next year, expanding throughout their system. And they continued to realize improvement. Of course, in this last year, they ran head into COVID-19. And this was especially hard in the FQHC we worked in within Queens, New York. So what did our action planning group, seeing that information and knowing where we stand, what did they conclude? In terms of the need that we think needs to be filled, we have shown, and others have, that you can increase flu vaccine rates with a quality improvement approach and a strong recommendation. However, research, and I'll share you a little bit of that, reveals that there are continuing disparities, and they're even widening nationwide. I happened to present to NVAC yesterday, the National Vaccine Advisory Council, and heard folks talking about getting back to the levels they were before the pandemic, and that's certainly not good enough for all populations. Finally, the need that is enhanced by the COVID-19 pandemic. So I noted that we have been doing some research as well as some practice transformation activities with groups around the country. And looking at Medicare fee-for-service data, this was from the 2015-16 season, and you see Dr. Puckrin was an author on this and other colleagues, that though that data set shows there is subpar flu vaccination in older adults, especially among Blacks and Hispanics. Indeed, all people of color were significantly less likely to receive a flu vaccine. especially a newer, more effective formula. And the vaccination rates varied geographically, not only at the state level, but down to the zip code level. So these are graphs from the publications that we have put out. I should note that Dr. Mahmoud has further probed these data and shown that these are differences. So this is how much less flu vaccine was received by Blacks, Asians, and Hispanics versus whites. Stunning. And further analysis showed that you couldn't really explain most of this difference except by race and ethnicity. This is a graph of the 1617 system. Each little colored shape is a zip code. These are for Black Medicare fee-for-service beneficiaries. And you can see that there are some zip codes where the vaccination rates were quite low. Another research project done by colleagues, including Dr. Zullo, showed that vaccination rates in nursing homes basically stayed the same over the last 20 years. But the difference between whites and Blacks grew during that time period. And that was largely attributable in their paper, they note, to Black majority versus white majority nursing homes. So reviewing our experience and data has led us to call for equity in flu vaccination and saying that it's more important than ever to increase flu vaccines in communities of color. I would also add that it was clearly and continually espoused that we have to build trust, we being healthcare providers, researchers, medical institutions, pharmaceutical companies. There has to be trust between us and the community. So how do we achieve improvement? Because we do believe it is possible to raise these rates and to realize better protection of health in communities around the country. How do we do that? It's an all hands on deck enterprise. So what do? Primary care teams, specialists, pharmacists, community healthcare providers, community leaders, patient advocates can all play a role in closing the gap. In terms of actually getting vaccines out there, the healthcare teams can be trained to make a strong recommendation. More clinicians and more types of clinicians can be involved in vaccinating or making a recommendation for vaccination. We can help practices, and practices can increase the perceived safety of getting a flu vaccine on their premises, the safety for their patients and their staff due to COVID-19. So really using social distancing approaches. We can implement high volume access to the flu vaccine with drive-through and mobile, and I'll talk a little bit about all of these things. We can begin and engage and enhance our communications with community leaders, trusted voices, from planning communications to vaccine provision. We also think it's important to target where the need is: communities of color, communities with historic low vaccine rates, and communities hard hit by COVID. So this is basically the diagram, or the paradigm, if you would, for moving forward to increase flu vaccine equity. There's got to be trust, enhance between provider and patient, and community and health system. We need to help our clinicians and health system apply new workflow approaches and have, including mobile and outdoor vaccination. We need to get every provider involved, and we need to use the tried and true evidence-based approaches. And we're not just saying in a report, this is what you have to do, although we will be releasing a report this afternoon and an infographic summary of it. We are offering an intense set of tools to help anyone who wants to work in their community on this, with guides and resources and opportunities for learning from the practice setting, from the community setting, and in terms of communications. I'm going to talk a little bit about our QI toolkit, and we're really lucky to have worked with Shanina in developing some infographics that are patient and culturally friendly. So here's the Drive toolkit, shcdrive.org. This is basically all you need to implement in your practice setting a program for increasing flu vaccination. And it also has tools for community engagement and organizing. I'm not going to walk through all of it, but there are basic steps, baseline assessment, engagement with the people who need to be on board and developing a sound plan that will be implemented and sustained, training, examples of activities that can help you move forward, worksheets and other resources for actually putting the plan in motion, and a toolkit for communicating and sustaining one's efforts. We will be conducting monthly coaching calls last Friday at noon through the end of this year, as well as providing opportunities to support systems and communities with launch. And we really want to spotlight your efforts with presentations, peer coaching, annual awards. Many of you will be inventing the new normal of how to get it done, and will be the best in showing others, your peers, in how to be effective. So we will be providing many opportunities in that regard. Again, go to the email in the chat box and let us know you want the release and you want to sign up. We are working with a number of community, well, let me just say here, I'm going to back up, I'm sorry. We have a community and clinical leader toolkit. Basically, it includes press release templates, social media graphics, infographics, messaging, a letter to the editor template, printable flu and COVID patient and community information cards. We're going to have a sermon that can be modified for your congregation. We want examples from you too. So I think you will find, this is going to be released this afternoon, that you'll have many resources to play a role in your community, no matter what position you hold. We are conducting a number of educational webinars, and here's a list of the groups we've already been working with or are planning to work with in the coming month. I want you to add your group here. Email us and we can make an educational webinar happen for your community of interest. Applying the Drive toolkit in practice improvement programs. So we are already working with a number of organizations to do activities that will increase flu vaccination, including those innovative approaches necessitated by the COVID pandemic. Are you one of the practices that also wants to work on this? Please reach out to us. We would love to work with you. We are doing a number of innovative programs to engage communities. You will hear Reverend Dr. King talk about the wonderful work we've commenced in Baltimore and PG County, and that's also in collaboration with Dr. Thomas and Dr. Quinn from Maryland, and with Lois Priver-Dumb from Johns Hopkins University Bloomberg School of Public Health. We're also working with the Pittsburgh Community Vaccine Collaborative via their Neighborhood Resilience Project. We have been in discussions with Walmart so they can distribute the patient infographics. We are supporting the SUNY Downstate School of Nursing and their medical students club to do mobile flu clinic in their community. And we want to work with you. You see, that's the last bullet on every slide. We have additional activities that are really about developing knowledge and exchanging it, because we don't know everything that's going to work this year. It's an unusual year, right, to say the least. So we're working with Plaza del Sol and NYU Steinhardt to really understand from residents of that community who have been so hard hit by COVID, how it's impacted their flu vaccine attitudes. This will inform their QI activity. We're working with Dr. Carolyn Poland to update the model on how healthcare providers can communicate about the flu vaccine during COVID-19. We're working with Dr. John Parrish-Sproul from Indiana University, Purdue University, Indianapolis, to develop with his students in the master's program videos from diverse members of their community about how important flu vaccine is for them. We have Dr. Greg Poland and Dr. Sacascio leading later this year a system-wide, a roundtable of system-wide leaders on why and how they should be promoting flu vaccination. Leaders in a high position can really make a difference. We're conducting a controlled study to evaluate this QI approach in a big medical system in New York. And finally, we're going to evaluate our program with the Dr. Henry Nuss at LSU's Public Health School. We have a lot of things going on. The program's being released this afternoon. I would ask you to email us to get on the list of those receiving the release information. And please join us. We want to hear from you. We want to work with you. We want to empower you to make a difference in your community. So I'm going to stop sharing there. And I think I'll turn it over. Well, Mia, you're the moderator. I know Shanina's next. And Shanina, please let me know if you want me to share your slides.
Thank you, Dr. Hall. That was a really very strong start to our conversation. And I just want to briefly summarize and really drive home, you know, the underlying point of your entire presentation is NMQF and your organization, SCH, is really very dedicated, consistently so, to working with partners on the ground, because trust really is the driver of ensuring that that flu vaccination and immunizations are followed up consistently, right, and increase. So for all of you who are asking questions about partnership in the chat, again, please email Dr. Laura Lee Hall, and she's provided the email at the top of the chat box. If you haven't received it, Keiko will again put it in the chat box. Okay, so we're gonna also ask Dr. Knighton to share some more things with us that are also related to communication, which is, again, a grounds of trust. So Dr. Knighton, please take it away. Also, do you want Dr. Hall to share your, we can hear you. Do you want Dr. Hall to share your slides, or you're doing that?
Sure, that'd be great, because I'm actually looking right now and it's not coming up on my screen. So I think that that would be great.
While Dr. Hall pulls up your slides, I'll also again remind people, if you want to be a part of the efforts that Dr. Hall's already mentioned, please email her at the email that's in the chat. Thank you.
Okay, so just giving you a really quick background, because I know we're a little bit behind. So I have a background in infection prevention, so that is what my science studies. So prior to COVID, I was actually studying pathogens in emergency departments and looking at how frequent or infrequent visitors, including patients and their family members, clean their hands. We were finding disgusting bugs then, and actually finding at the point of contact that patients had in between their care, they were not cleaning their hands. And so that's also some work that I've been doing on the acute care side, as well as trying to figure out ways to eliminate barriers for older adults to clean their hands. This translated into the community because I noticed that if patients on the inpatient side was having issues with understanding infection prevention or had a lack of knowledge of it, I very well know that our patients in the hospital are also our patients in the community. And so I took my passion for inpatient and started to move it outpatient. Next slide, please. So the infographics that I'm sharing specifically as it relates to National Minority Quality Forums and the Center for Sustainable Healthcare Quality and Equities campaign and push for prevention is towards flu, but it's also a reminder that even though we are pushing for flu vaccines, we're pushing for prevention of flu, is the fact that COVID has not left. So right now, we know that patients, in terms of information that they have, it's always a push to go to the World Health Organization's website, CDC's website. But we continue to forget that there is a digital disparity, as well as there are older adults who may not have accessible information. And also when we talk about practice, someone may say, get your flu shot, but many people don't know why. Someone may say, I may have COVID or I may have flu, I don't know which one. How does that work? And so this provides a depiction of things that they should know about the symptoms. So this could go from children and adults. So the symptomology is mixed, but some of them do differ if it is based off of a child or an adult. But generally, these are symptoms that people should see. It's also letting people know that you can get COVID and flu at the same time. And if you already have some sort of underlying condition or older age, we all know that minorities are at higher risk. You want to make sure that you're doing what you can to prevent getting ill from one, let alone both of them. And so that is where the push comes in at. So we all know that we've seen hand hygiene, wearing masks, keeping our immune system strong, and then staying home if we suspect that we're sick. Next slide, please. So the flu vaccine. So there is this notion that the flu vaccine gives you the flu, and that's not true. We try to emphasize to people that when you take the flu vaccine, what it is doing is it's helping your body to build up antibodies or build up a defense system. Should the flu strain come around you, it can make sure that you actually have less symptoms or no symptoms at all if you are to encounter the flu. It also helps others around you. So for example, if they are to get sick, but you're protected, then it stops you from being able to spread it as much as you would typically spread it. Of course, there are still things that have to work along with that, meaning that you still practice cough, sneeze etiquette, eating healthy foods. And so essentially with these infographics, we're sharing the information, but we're sharing it in a different way. So we share it as if the words will draw in the individuals, or the pictures are going to draw people to the words. This is strategically done in regards to the processes for each of these infographics. We're actually out in the community. So I may take a list, a sheet of paper, and I'll actually write down some of the things in order that should be considered when it comes down to taking the flu vaccine. What will then happen is I'll have someone read it. If they can understand the information very clearly, then we're good, and that's within a couple of minutes. If for whatever reason they're challenged with being able to understand the information, I then will go back to the drawing board, and I'll then take it and present it to another set of individuals. And I'm talking about literally just walking around in a community that I'll serve. Then I'll take around the infographics once they're created, and I'll say, okay, so tell me about some things. Give me 5 things after looking at this for 2 minutes that you got out of it. If they're still having a hard time communicating that, then that lets me know that I didn't get the message across. So I'm doing this with older generations, younger generations, and getting a good mix of what I would call ethnography, or, walking ethnography, and not even really data, but just really trying to do this to help others. Next slide, please. I keep trying to clean. So same thing with managing life at COVID. So there may be the thing about preventing it, which I believe prevention is better than treatment. Then there's the actual flu vaccine itself. But what if someone is living at home? I've had plenty of instances of where someone may say, oh, make a sick room, or have this particular criteria, or do this or do that. But we have to realize that not everyone has the same exact resources, which means that if there are siblings that share in the room and one of them is sick and the other one isn't, how do you manage that? If you are talking about a space that air conditioning, you may need air conditioning because the ventilation system isn't too good. So sometimes people are just on top of each other, and there's no choice but for them to open up windows, for them to make sure that they're cleaning items that are around. And so these are some of the infographics that we share as well. So just really quick, we can move on to the next slide. So I'm sure the video, you can probably see me up in the corner. So before I even talk about this one, we take this ring and this infographic, and this is what is passed out in the community. And so the infographics are front and back in here, and it provides practical information. And so we've actually done over 20,000 porch drops in our community where we take these and we'll just pass them out and put them on someone's porch in order for them to have practical information. Lifestyle habits, same exact thing. So we're telling people, like, we understand that there may be the sharing of cigarettes, vape pens, drinks, or utensils, advising people that now is not the time to do it, letting them know, you know, that COVID does have an impact on the lungs. And so you want to make sure, flu does too, you still want to make sure that they're not doing anything to compromise themselves, or understanding that while they can be practicing hand hygiene and they can be socially distancing and wearing a mask, there are other measures that can make them more vulnerable to getting COVID-19 flu or some other type of respiratory illness. Next slide, please. So I would be remiss really quickly if I don't talk about cell phones. Cell phones are 10 times dirtier than the toilet. We put them right on our face. A lot of them put them up to our mask. We have children that have cell phones. We sit cell phones on top of surfaces or tables. We may then put it up to our face. Understand, COVID transfers through eyes, mouth, and nose. So any substance, any resource, anything that you would put up to your face that can be a potential contaminant puts you at risk of getting some sort of germ towards your face, whether that is some sort of viral germ or some sort of bacteria or some sort of fungus. So it is very important that you at least try to be conscious about cleaning your phones. A lot of us touch our phones with our fingers and don't clean them in between. So it's very important to keep that in mind as well. And I just had to kind of put that in here in the mix. Next slide, please. Also, too, on the right, and Keiko, if you can, to the right side of the screen, just pull the volume down. So if you hover over it and just, you see right there, like on the right-hand side. Okay, so it's actually good. So the hands that are on the screen right now, many people don't realize that they are cleaning their hands incorrectly. So only about 3 to 6% of people clean their hands correctly. They typically forget the fingertips. Upon forgetting the fingertips, we also have the area where the thumb meets the hand. And so many people forget to clean that area as well. And we also forget to clean our fingernails. And so I'm sure you've seen people that clean their hands, but their fingernails are dirty. And then we also forget to clean our wrists. The reason why I'm bringing this particular thing up is because if we don't clean our hands correctly, if we don't wear our mask correctly, if we're not cleaning surfaces correctly, meaning that we're allowing appropriate contact time for surface cleaning, then it didn't happen. So we have to make sure that we're conscious about how we're cleaning all of the items that are around us, including our hands. Next slide, please. I'm going to not go over this slide because I know Laura Lee brought it up really, really quickly, but I just want to just show that mask moisture. We have to remember that the mouth is proclaimed to be the dirtiest thing on the body. So if we're breathing things towards the mask and that's a barrier and things can come into the mask and those are potential germs, we want to make sure that we're keeping our mask as dry as possible. So if you are a mouth breather, make sure that you're carrying more than one mask and make sure that you're allowing your mask enough time to be able to dry. There are these things too now, which are these mask lanyards. If you are wearing a mask lanyard, just make sure that you're not wearing the lanyard outwards to where both sides of the mask are exposed. Make sure that the part that will be closest to your face is enclosed so that way it doesn't have any risk of contaminants coming into it. Next slide, please. This is just a reminder for anyone that wears their mask beneath the chin. If you are in a setting, or let's say you're in an elevator and droplets fall down, okay? If the droplets fall down and they, let's say, land on your neck area, you then pull your mask down over your neck area, which means that you've captured the germs that are on your neck. You then go to pull your mask back up over your nose. Just as I mentioned, COVID transfers, flu transfers, viruses transfers, eyes, mouth, and nose. You have now taken all of the germs that were potentially on your neck and the lower part of your body down here, and you've now moved it right up to your mouth and nose for a direct entry route. It is appropriate that you remove the mask from ear to ear. Remember, if you do not wear it right, then it did not happen, because it eliminates the whole purpose of us wearing it, which is to stop droplets from coming through. But pulling it down to your neck area just gives it a open entryway. Next slide, please. So that's all that I have. I typically allow all of these ways for individuals to be able to get in touch with me. I do it for social media simply because we all know that in this era of COVID, there are a lot of conspiracy theories out there. You'd be surprised about how many I'm getting in my inbox in regards to how COVID got here, how flu gets here, what the flu vaccine is meant to do. And so it is very important that as I see, let's say, misposts come up of individuals that I know, I can also address them about them. Or let's say if someone needs to inbox me and they have a question, then it provides a level of accessibility. I put my name on these infographics on purpose because we know that our communities are distrusting of the material. So when they do see it and they see me as a woman of color, it does give them some hope that the information that they are receiving is believable, okay? And then even too, when they're talking to me, I have no problem at all talking to them about their biases or about their thoughts, but I let them know that I would not be a scientist if I fed into the biases or conformed. Our job is to discover, are there other ways that we should be doing things, and what is the most correct approach? And so as long as we're communicating that message and not just agreeing just to agree, then I think that we can go a long way. And thank you, and I think I'm passing it back over to Mia.
Dr. Knighton, as usual, thank you so much for that vivid information. I think it's quite clear that, especially for the audience members, that we can use that information really well in our various spheres of influence. And speaking of influence, when we talk about those who are trusted in the community, a lot of those voices are voices in the pulpit, voices in worship centers. And so I'm very excited that we have with us Reverend Dr. Terrace King, who is going to talk to us now about engaging the community in his capacity and ways that you all as audience members can consider partnering with religious leaders as well as academic institutions to promote sustainable change and behavior modification around keeping ourselves well. So Dr. King, I will hand it over to you, sir. If you can make sure to unmute, we can't hear the lovely things you're saying.
Oh, I was saying great things too. I tell you. Can you hear me now?
We sure can. Thank you.
Great. That's great. That's great. Well, thank you so much for giving me the opportunity just to talk to you about the things we're doing here in Baltimore to increase the vaccine rates in terms of flu and influenza. I want to start out by telling you that I kind of come to this with a different background from the pulpit than most of my colleagues, which have caused many of them, at least in the city, to push me forward to be a liaison, if you will, behind our efforts and working with Laura Lee and the National Minority Quality Forum. My connection with this organization and with Gary Puckering really, and I don't want to age myself, starts decades ago. I served for over 30 years in the last part of my career in the federal government as a senior executive of healthcare for the last 15 years. And that experience as a healthcare policymaker kind of gives me a different perspective as someone who is both blessed to have a part and to play a role in the pulpit in terms of my congregation and community, but it also gives me a backdrop of what occurs from a health policy perspective and what really works well as it relates to community engagement. One of the things that Gary Puckering and I had a chance to establish, just in giving you the backdrop, and then that goes well into what we're doing today. And it really goes back to a lot of what Dr. Knighton was saying, and dealing with conspiracy theories and dealing with perspectives in the African American community. It really goes back to some of the efforts that we had afoot decades ago. Gary and I had a chance to establish what is still the largest health disparities, or in modern terms, health equity initiatives in the federal government. Something called Every Person with Diabetes Counts. And that effort, which was novel at the time, was really about working with clinicians and patients with diabetes. And we dealt with some of the same conspiracy issues with individuals in the Deep South and across the country who were suffering from what they call sugar, and working with their clinicians and understanding that how in many instances Black bodies were valued or devalued, and how in many instances amputation was emphasized over therapeutic methods, over innovative methods, and over methods that really tended to keep those limbs intact. Whereas with other races, those methods were put forward first. So we had to debunk not just the conspiracy theories, but we had to be authentic in the same way we're talking about today, and truthful with individuals about what actually existed, that we all read about in books like Medical Apartheid, but which exists today in terms of mistreatment. And this is the backdrop: mistreatment as it relates to healthcare unequal treatment, and as it relates to research. And we had to be knowledgeable of the issues that had transpired in order to talk to our community and establish a program that still exists that improves the healthcare dynamic and the health outcomes of African Americans and Latinos across the country. Still the largest existing program. To age myself a bit more, there's a process that many on this call, I'm sure, are aware of that really has to do with community engagement. And that process is called community-based participatory research. I had the privilege to be a part of the inaugural part of that process established by NIH, working with Dr. John Ruffin, who, as you all know, founded or established the Institution of Minority Health and NIH. What that process really taught me was how, as an institution with major budget, with major staff, how to engage with the community, treat them with respect, understand the parallels of power that exist and are so important, and how to engage them in a way where, with that a respect level, we could then move forward with initiatives that were important to them as well as us. But not to come to them with a cake that was already baked. And I think if there's anything in the process that I'm going to talk about first, it's what I just said. Engaging communities means, to me, don't come with the cake already baked, but make sure you come with a process that is still being developed, and have an openness to work with communities to find out who those leaders are in our cities, who they are, both titled and untitled, who have the tremendous influence on what individuals do. So what are we doing in Baltimore City? Laura Lee has and the National Minority Quality Forum has given us a great opportunity to address this issue. Let me also give as a backdrop to this that since February, many of our congregations throughout the city and still today are still operating electronically. Let me also say that for many of us, our congregations electronically have tremendously increased. I'll give you an example as I walk into what we're doing in our pilot and working with some of the most influential ministers in Baltimore City. Let's give you as an example what's happening in my church, where there are 400 or 500 members that I have, and I try not to ever count my members, but to weigh them in terms of their commitment to what we do. But as we see on Sunday morning now, electronically, I have over 1,000 people that often join us. Why? Because we go right back to what Dr. Knighton said. Conspiracy theories are running so rampant at this point throughout our cities, throughout our country, misinformation, changing information, information where you don't know who's telling you the truth, you don't know what the agendas are, that individuals who are not normally religious or spiritual or a part of the church or a part of our congregation are on the line. And they're on the line because this is one of the places, and we happen to be one of the churches that is not hesitant of bringing experts into those discussions so that the issues of the sanctuary and spirituality are integrated with the issues of science. We look at this from the perspective that all things work together for the good. So we're bringing that information into our congregations to educate and inform our members so that we can use what we call holy common sense and taking next step approaches. Now both my congregation and many of the ministers throughout the city have gravitated to my perspective on this because they understand that as it relates to healthcare policy, I have operated for much of my career at the highest levels of government. So I don't have to guess what's going on behind the curtain. I know how priorities are formulated. I know how they're budgeted. I know how they're focused upon. And I bring that information into the congregation and for the benefit of others. So what are we doing? We have several ministers on all sides of the city working together to raise flu and influenza rates. And let me say, we've had conversations, and Laura already mentioned the fact that it's not just ministers, but we're working with Johns Hopkins, who here in Baltimore and across the world is a major healthcare and research player. University of Maryland and their Health Equity Center with Dr. Thomas and Sandra Quinn and Lois Dunn, once again, in that Bloomberg Public Policy Group. So we have the experts there from a public policy perspective and access to the doctors who can give us the kind of vital information that Dr. Knighton has given us today. But we add something different. And it's that issue of trusted source. Let me pause a minute. In Baltimore City, which I think is a microcosm of many of our cities, our congregations and many of our citizens in Baltimore don't trust the healthcare system. They certainly don't trust researchers. The backdrop is this, is they heard well Dr. Fauci and our president step on stage and say that there was disparate levels of morbidity and mortality among African Americans as it relates to COVID, meaning we die more once we get the disease. But they didn't hear a plan of what would happen to address it. And it has caused, to some degree, a major panic. So now what is this issue about? What are we saying to them? We're saying that during the winter, during the fall and winter, we don't want you to get the sniffles. This is what we're saying from our pulpits. We want to make sure that through these flu and vaccine efforts, we boost your immune system so that if you get COVID, it will lessen the severity of the disease on your body. My church in particular is in the 21215 area of Baltimore. And that is the area where COVID, unfortunately, was at its most dense state in our city. So it's where the spread of COVID was at its absolute greatest. What have these ministers given us to think about? Ministers like Dr. Hathaway and Dante Hickman and Bishop Carter and Mike Phillips. These ministers have brought us, and they vary. They vary. Many of these ministers are speaking to millennials. Dr. Mike Phillips, for example, Kingdom Life Church, 70% of his members are millennials. One of the fastest growing churches in Baltimore, several thousand people. What does he tell us? You have to meet millennials where they are. That means you don't call them. You don't try to reach them in a paper or over the television screen because they're not there. Where are they? Social media. You have to meet them where they communicate. You have to have these focus groups on social media, and what you have to do is learn how to hear them before you heal them. They have to be heard because they already have their own perspective that they've gotten many times from misinformation on social media. Quickly, we've learned from Dr. Hickman, who is East Baltimore's side, bring mobile units to the church. People who are still on Zoom would so like to see each other that they would come out for a mobile unit just to be able to see each other behind a mask. Working with Dr. Pam Urey and her church, she looks at this from the mental health perspective because this has had a horrific mental health impact, isolation on our members. Depression is at an all-time high. Our services have transformed into therapy sessions. And the same way we go at mental health, because in the Black community, mental health is taboo, is the same way you have to deal with COVID. Because for too many people, they treat COVID and explain they have it as if it was AIDS in its beginning. They don't want to admit it. So you have to take that same approach where now I have over 5 members who were on the screen with COVID in their hospital beds, who wanted to be seen suffering from COVID to send a message about the severity of the disease. And they are promoting getting these flu and influenza shots. We have Bishop Carter, who's talking about at the beginning when COVID hit, over 12 of his members died within the first 2 weeks. That gives you the serious nature and impact of what we are dealing with, to say, you got to boost these people's immune systems every possible way you can. What are we going to do? Commercials, sermons, radio, educational processes, press, by any means necessary. That's exactly what we're doing.
You said it just perfectly with that, Reverend Dr. King. And, truly appreciate everything that you are doing in your community beyond your congregational walls. It's really not out of the ordinary to engage, or really it shouldn't be, to engage one's spirituality and one's civic wellness, right? That's truly what it comes down to. And even, and for those who are not, who do not subscribe to the Christian faith, it's the same as well for people who are across various religiosities. And so if you are yourself, and I'll say this to the audience, a part of different congregations, do encourage your leaders, your faith leaders, to make certain that they're making those connections for the entire congregation to be involved. So thank you so much, Dr. King.
You're very welcome.
To ask, absolutely. And thank you much for Dr. Knighton being here and bringing her words, and again, just laying out the significance of trust, and to Dr. King's words, meeting people where they are and using very clear, vivid information to pass life-changing and behavior-changing information. So thank you, Dr. Knighton. I'm going to ask Dr. Hall to close us out with any final words, any summary words before we also bid adieu to the audience.
Thank you so much, everyone. I really appreciate that we've had so many participants, and I have been looking at the chat box and the Q&A box. I would ask you to send your comments to the email address in the chat box. We will definitely get back to you about best ways to identify community leaders and issues that clinical teams or community groups may need help with in terms of implementing a flu vaccine drive. I also indicated in the chat box some other activities going on, and we will keep our website updated to resources and live programming that you may find value in, like NFID's upcoming event. And I just thank everyone. We have a lot to get done, but let's try to make the new normal even better. Thank you, Mia.
You couldn't have said it any better as well. And I thank you, Dr. Hall, Larlee Hall, Dr. Shanina Knighton, and Reverend Dr. Terrace King. Appreciate you three coming through, and we look forward to seeing you in the next conversation next Friday. As always, I'm Mia Keys with the American Medical Association Center for Health Equity and NMQF. We appreciate you and all that you do, and we hope that everyone has a fantastic day.